Hi, I'm Dr. Rajani. Thanks for joining me for Raji's Quick Clip. We're talking today about RF face, radio frequency energy for the face. It can do a couple of things, but mainly tighten skin and reduce fat. I've had a lot of questions about do at-home devices work? What's the best device? Ulthera, high frequency ultrasound versus radio frequency. A lot of people ask that. I'm going to refer you to an answer on that today. We're going to watch a little bit of the treatments. I'm going to show you why radio frequency can work well, what you should be looking for in a device or a procedure. Let's get started with a Raji's Quick Clip in 3 seconds. So remember, if you like these videos, click like. I have playlists. I added one on the neck, and also you can watch my Kybella one, or fat dissolving. A lot of people are asking questions with regards to radio frequency for skin tightening or body tightening or fat reduction. And I have a whole playlist on that where you can just run through and watch fat dissolving, be it the face or body. Click like and subscribe to these videos for continued tips, and I'll keep bringing the videos to you. So, when we're talking about radio frequency energy, the first thing, and what got me thinking about sending this video and putting it up, was at-home devices. And with everyone at home, they want to know, do radio frequency devices work at home? To understand it, you first have to know what we're trying to treat. The two main things are skin tightening and fat. And when I hear people say the non-surgical facelift, it's a misnomer. And people have videos on, you don't need plastic surgery, just get heating, if it's high frequency ultrasound or radio frequency. As you can imagine, it depends on the candidate, the amount of loose skin, and what's going on. But radio frequency devices are not a substitute for structurally fixing or structurally adding support and lift, if you will, to the tissues, or a facelift. If there's a lot of loose skin, someone's going to need a facelift. What happens if they don't? They say the device doesn't work, they ask for their money back, and they go and write a bad review about it, and people see the review and say, I'm not getting that procedure done, I'm not buying that device. It doesn't have to do with the device if it's in a medical spa or a medical physician's office where they're buying a device that works, that has enough energy and enough power, and the right technician. If you look at the device here, look at the heads on the device. There's two silver plates. The heating energy, the electrical energy, jumps between them both. These are bipolar radio frequency. And with that, depending on the frequency, you can go to different depths so it's tunable, but also you need the right amount of energy to produce heat. What's the temperature? 42, 41, 43 degrees C. So you have to, and that's where you go, they go, oh, it's so painful. And it can be. If you're trying to get fat, if you're going to the deepest layers, you're going to jack the temperature up. You're going to turn it up, or you're going to do more passes, if you will. So does it work? Home devices often don't have the energy needed to get the tissue to the temperature, or if some people need intense treatments, the anesthesia needed that a clinic's going to provide for you to get there. So if the at-home device did, it would work. If the technician was good, and in that case, maybe it would be you, the technician. But I don't see the devices with enough energy getting the tissue confluently, meaning not in a zap of minuscule heat. Imagine if you just got the heat, it wasn't uniform. You can get irregularities. A lot of people are going to comment, I want to see in the comments, they're going to say, hey, they'll say L-therapy, they'll say Thermage, because that's the ones they know. Some type of radio frequency or high frequency ultrasound, they'll say, I lost my facial fat and I've never looked the same. How do I get it back? You're going to see that here in the comments. And so why? It's because too much temperature or too deep, or someone went in and tried to get a facelift without having it done, and the technician turned it up, went through more passes. And when you think about cost, in general, a lot of times this is a $2,000 to $7,000 procedure, depending on what area, what you're getting done. The neck lift would be a common one. Average would be $2,000 to $2,500 United States dollars. So it's not a inexpensive procedure, and people expect a lot for $2,000. So the key factors, yes, radio frequency energy works. It works by heating. You've got to get to the right temperature. You have to have the right device. You have to have the right technician, and you need to have the right candidate. All those things have to come into play. And a lot of times it will be what? A combination procedure. We're going to add platelet-rich fibrin, maybe hyperdilute radius, PDO threads, and a few sessions of the radio frequency. If someone has to get it all done in one, it's hard to tailor a treatment to someone who wants it all at once. You might find you're getting some of the fat removed because they're increasing the temperatures or they're being more aggressive. So I like doing it in stages. So radio frequency, it does work. What's been your experience? You like radio frequency, high frequency ultrasound? Watch my video on RF versus high frequency ultrasound, and stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.